What really sparked me to want to help people medically was when my grandmother suffered from dementia. In experiencing how one person's illness not only impacted the individual themselves, but the family as a whole.
So my grandma's actually from Yorkshire, so I was listening to her birthing stories. She was a traditional birth attendant, used to go around and birth babies. And then on my dad's side, my Aboriginal lineage, my nan was also a nurse, and she used to also go around and help people birth their babies as well. So I became interested in midwifery through that.
You could be, a paediatric nurse, an orthopaedics nurse, working with bones, working in operating rooms, emergency departments, community health, drug and alcohol rehabilitation, physical rehabilitation, school nurses.
People often say to me, "Oh, babies still come out the same way," which I'm a bit intolerant of. I really say yes, but the care we provide to women and their babies around the time of birth, through pregnancy and through into those early weeks and months of mothering and becoming a family, have changed.
When I was a student nurse and you had to test someone's, you might have to test a stool specimen for blood or something like that, you often actually had to get out a Bunsen burner and put a specimen in and add things to it and burn it and, look for colour changes, and the way things are now is just incredibly different.
I would say there's been a huge increase in the cultural capability of services over the last 10 years. When I first started, there were no specific Aboriginal and Torres Strait Islander services for women in this area, and so that's my driving force to keep going and continue and make changes that our mob needs.
We now have compelling evidence that mothers and their babies do better, much better, on every outcome when you have the same midwife look after the woman throughout the pregnancy, throughout the labour and birth, and throughout that postpartum after birth period.
Florence Nightingale said, "Let us never consider ourselves finished nurses. We must be learning all of our lives." And as a soon-to-be graduating nurse, it is this dedication that I hope to keep throughout my nursing career.
There is a difference between nursing and midwifery. They're not the same. So when you do your degree to become a nurse, you can only practice as a registered nurse. And that is everywhere in the hospital except in the maternity services. On the other hand, if you do your degree to become a midwife, you can only practice in the midwifery and maternity services and newborn area. We have bachelor degrees in nursing and midwifery, but we also have postgraduate degrees in a range of areas such as critical care, emergency, infection prevention and control, primary maternity care, and we also teach for PhD students who become a doctor of nursing or a doctor of midwifery.
I chose Griffith University for my degree because after much research I really loved the flexibility that Griffith offered with study. I wasn't sure if I would be able to maintain the full-time study load having a young family. But I knew that I could apply full-time and I had the flexibility to go back to part-time if I needed to, and uni would support me with that decision. I've always had an admiration for midwives, but it wasn't until I had my first child where I really got to see what they do and the impact they can have on your experience in childbirth, and so that sort of was my big eye-opener, and I went, oh, I've got to do that. That's amazing. So I went on to have 4 more children, and my passion just grew more and more and more from my own personal experiences. There's a lot of practical work involved in our degree. Obviously, being a health degree, it's very hands-on, and you can learn so much in theory, and you've got to have some theory to be able to put it into practice.
In both nursing and midwifery, it's really important that we have theory as well as practical. The theory is so important because you've got to understand why you're doing something to a patient. The practical is we're preparing you to be able to do those practical skills, and we do that in simulated laboratories.
The simulations are great because they replicate the hospital exactly, so we can walk into a lab and it looks like we're at the hospital. All the equipment, all the medical supplies that we're using at the hospital are what we have here in the labs. So we can, just get used to the feel of everything, and gives us that confidence when we walk into the hospital.
What sets Griffith apart is our attention to students, making sure that the student experience is of top quality, but also that our students are highly satisfied with their learning experiences.
There's never really a right time if you wait for the right time. If you've got support around you, if you've got a passion for it, just jump in and apply. You won't regret it.
Welcome to our award-winning School of Nursing and Midwifery. My name is Dr. Victoria Kane, and I'm here to take you for a short tour through our programs. Griffith University acknowledges the traditional custodians of the land on which we meet today. For me, the Jagera, Yugera and Yurangapal people, and pays respects to the elders past and present, and extends that respect to all Aboriginal and Torres Strait Islander people. Our school offers degrees that will help you build a career in nursing, whether you're considering a career in nursing or you're ready to take that next step in your nursing career towards postgraduate study. By undertaking a degree in nursing, you'll be well placed to use your high-level communication and multitasking skills to care for patients and community. You'll experience a career where the scope of practice is growing, one that sees you delivering high-quality healthcare in anywhere from hospitals, schools, sporting clubs and aged care facilities in urban, regional and remote settings. Our qualifications are recognised globally and highly regarded by healthcare providers in Australia and around the world. The Griffith School of Nursing and Midwifery is committed to the development of nursing practice, theory and research that transforms lives and healthcare. We develop remarkable graduates imbued with a solution-focused philosophy who make a positive difference in nursing and healthcare, transforming the lives of those in their care. Through developing research, consultancy and continuing education opportunities, we seek to serve the nursing profession, the healthcare system and the broader community. Healthcare and social assistance is one of Australia's fastest growing industries and is projected to continue to grow over the next 5 years. You'll graduate with a solid foundation of theoretical knowledge and practical application. Griffith nursing graduates are highly sought after and employed in hospitals and healthcare centres all over the world. During placement, our students gain a great deal of clinical experience within the very workplaces that may then employ them. Our degrees are taught by dedicated professionals. We are Australia's #1 ranked university for nursing and midwifery, and we're ranked #2 in the world. By studying with us, you'll learn in and out of the classroom, gaining hands-on experience through placements in healthcare organisations and hospitals. The Bachelor of Nursing is offered full-time or part-time on campus at the Gold Coast, the Nathan and the Logan campuses. As a full-time student, you can generally expect to attend 15 to 20 hours of scheduled classes per week throughout the trimester. Classes may be scheduled during the day and evening throughout the week. Part-time students will be required for approximately 8 to 12 hours of scheduled classes per week, and these may often be during the day. Part-time students must be available full-time for all professional placements. At the Griffith School of Nursing and Midwifery, we ensure that our students keep pace with the rapid changes and challenges in healthcare by fostering an atmosphere of learning that has earned us a national and international reputation for excellence in teaching, research and clinical practice. At Griffith University, our highly awarded teachers are committed to developing competent and accountable nurses able to work in partnership with clients, to provide high quality, safe and effective care, use complex skills and knowledge to save lives, prevent suffering and promote health. Our Bachelor of Nursing requires that students spend considerable time undertaking hands-on experience in on-campus clinical laboratories and within hospitals and other off-campus clinical settings. In this program, you will spend time in the professional environment undertaking placements at various locations. Placements may be outside of the Brisbane metropolitan or Gold Coast areas, including northern New South Wales and, by negotiation, interstate or overseas. Interstate and overseas placements are only permitted in the final clinical year, which is year 3 of the program. We also offer a variety of nursing and midwifery postgraduate degrees across a wide range of specialty areas. Our postgraduate degrees are designed to offer the busy clinician full flexibility. All of our degrees are offered online so that you can study where you wish, when you wish. Thank you for your interest in our programs.
Hello, my name's Dr. Amanda Carter and I have the great privilege of being the Program Director at the Bachelor of Midwifery program at Griffith University. I'd like to take this opportunity to talk to you about the program and also talk about why you might choose to study midwifery at Griffith, Australia's #1 midwifery program. Our Bachelor of Midwifery graduates are recognised and preferred by employers. 100% of our graduates have an employed position within 6 months of graduation. Employers recognise that the students are well prepared, being technically competent, deeply woman-centred and have sound clinical judgment skills. The program runs in a flexible way. It has a unique blended learning design where we combine face-to-face sessions which concentrate on clinical skill development and simulation with online learning which comprises of modules, activities, readings, discussions with other students and lectures, and also of course extensive professional placement. Students are placed in the same organisation for the whole 3 years of their degree, and they're supported by one of our own midwifery lecturers who not only teaches in the program but also supports the students in the hospital environment 2 days a week. The flexibility of the program is designed to support students undertake what we call continuity of care experiences. This is where students have the unique opportunity to follow women through their pregnancy, their labour and birth, and that transition to motherhood. And that's a requirement of 20 of those throughout the degree. We know from our research about this model that that provides the deepest level of learning for midwifery students. We have expert staff. So our staff and our program are award-winning. Our program has won national and international awards, and the Midwifery at Griffith team are well-renowned researchers transforming midwifery care and education. As a way of an overview, the degree is a 3-year degree. There is an option of undertaking the first year over 2 years, which may help some students transition to tertiary study. It's 240 credit points, and the program runs in extended trimesters, so runs over 46 weeks of the year where you'll be undertaking professional practice throughout those 46 weeks. There's a big focus on clinical practice. 50% of our degree is clinical practice. Students often ask me what the requirements are on campus. So the commitments are through our MILE sessions, our midwifery immersive learning experiences, where students attend for 1 to 2 weeks at the beginning of each trimester and then for full 5 days during the trimester. All of the MILE sessions are held on Logan campus, with some of the sessions also available at Gold Coast campus and also some at Toowoomba. The clinical requirements, as I said, were quite extensive and require quite a significant commitment and flexibility. They're between 1,800 and 2,000 clinical hours in the program, and that comprises of approximately 2 to 3 shifts every week across the 46 weeks of the year. And also on top of that, the completing the 20 continuity of care experiences that I mentioned before. That's where you'll attend with the woman her pregnancy visits, be on call for her labour and birth, so that's where you need the flexibility, because obviously that can happen at any time of day or night, and also see her at least 3 times after the baby's born. Midwifery at Griffith has partner agreements with a number of hospitals, and we have guaranteed clinical placements at those hospitals. So those hospitals are Logan, Redlands and Toowoomba, Gold Coast University Hospital and Sunshine Coast University Hospital. We also have a small number of students placed within midwifery private practices. It's really important that you do live near the clinical placement sites because of the on-call requirements. So if you don't live near any of these sites and you're not able to undertake placement at one of the sites listed on the slide, then please contact me as Program Director prior to applying for the program. So I hope that's provided a bit of an overview for you. Thank you for listening. Thank you for your interest in the program. And my email address is on the slide if you have any more questions. Thank you.